According to the World Health Organization, waste is a product of the human activities that are not longer used, either unused, unloved, or disposed of. Littering means disposing of waste in an improper place so that the garbage becomes scattered.
Littering has become a habit of the communities around us. Many of them throw littering either in public place, public transportation, on the river, or on the roadside.
Based on the type of waste is divided into medical waste, non-medical waste. Medical waste is
Waste originating from medical service, dental care, pharmaceutical, research, treatment, care, or education that use material that are poisonous, infectious, or dangerous.
and non-medical waste is waste generated from non-medical activities in hospital or other healthcare facilities.
Originating from kitchen, office, park, and yard.
Waste can be divided into recyclable and non-recyclable waste. Example of recyclable waste is bottle,
Plastic bag, cardboard box, and old tires. Example of waste that cannot be recycled are styrofoam, tissue, baby diapers, and sanitary napkins. The color of garbage bag is distinguished based on the type of garbage, both non-medical waste and medical waste. Non-medical waste use black plastic and medical waste use yellow, red, brown, and purple plastic waste. Yellow plastic used to collect pathological and infectious waste. Red plastic is used to collect radioactive waste. Radioactive waste usually come from laboratories, which are mostly in the form of radioactive substance. Brown plastic is used to collect pharmaceutical waste. Pharmaceutical waste can be in the form of unused or expired drug. Purple plastic is used to collect cytotoxic waste. Cytotoxic waste is remnant of chemotherapy activity.
Diseases that can arise from littering are: number 1, diarrhea; number 2, dengue hemorrhagic fever; number 3, pest; 4, typhoid; number 5, leptospirosis.
Diarrhea. Data from the Indonesian Ministry of Health 2016 states the number of diarrhea cases held by health agency in Indonesia decreased each year. In the world, the prevalence of diarrhea in 2015, diarrhea caused in estimate 688 million people and 499 dead worldwide. Number 2, dengue hemorrhagic fever. In 2016, DHF cases were reported as many as 8,407 cases with 493 people dead. An estimate 50 million dengue infections occur worldwide every year. Number 3, pest. The largest case of pest was reported from Kabupaten Pasuruan in 2007, where 18 cases. After 11 years from the last case, from 2007 until now, there were no case reports. The epidemic of bubonic plague in the world began in the 13th century account 1,347. These cases occurred in China and India. Number 4. Typhoid. Indonesia ranks 3 among countries in the world. WHO estimates there are 17 million cases of typhoid fever worldwide with an incidence of 600,000 deaths each year. Number 5. Leptospirosis. Leptospirosis cases in Indonesia in the period of 2004 until 2010 tend to experience an increase in both the number of cases and deaths. According to WHO estimate 2011, every year there are more than 500,000 cases of leptospirosis worldwide.
The effect of sugar carelessly can cause various diseases. The first is diarrhea. Diarrhea is defecation with a consistency of semi-solid or liquid feces and increase in frequency more than 3 times a day. Epidemiology of diarrhea. Diarrhea is still a public health problem in developing countries like Indonesia because diarrhea morbidity and mortality is still high. When viewed per age group, diarrhea is spread in all age groups with the highest prevalence detected in toddlers 1 to 4 years old of age, reaching 16.7%. The prevalence of diarrhea is more in rural than urban area, which is 10% in rural area and 7.4% in urban area. Diarrhea tends to be higher in the lower education group and work as farmers or fishermen and laborers. Diarrhea can be classified based on: first, according to etiology; second, according to pathophysiology; third, according to period of diarrhea. Pathophysiology of diarrhea. Diarrhea generally occurs because of one or several overlapping mechanisms or pathology. For example, osmotic diarrhea. Osmotic diarrhea is diarrhea caused by absorption disorder, which are caused by: first, consume magnesium hydroxide; second, lactase deficiency; third, there are material that are not absorbed. Material that cannot be absorbed will cause the intraluminal material in the small intestine to be proximal, hypertonic, and cause hyperosmolarity. As a result of the difference in osmosis pressure between the intestinal lumen and the blood in the permeable segment of jejunum, then the water will flow toward the lumen jejunum, so that much water will accumulate in the intestinal lumen. Natrium will enter the lumen so that intralumen fluid increase. A small portion of the liquid will be reabsorbed, but others will remain in the lumen because there are material that cannot be absorbed, such as magnesium, glucose, sucrose, lactose, maltose in the ileum segment that exceed the ability of absorption the colon, so that diarrhea occurs.
5-level prevention for diarrhea.
The best effective way to deal with diarrhea is by health promotion, by promoting of diarrhea and how to prevent it. Specific protection by washing hands and cooking the food before eating. Early diagnosis and prompt treatment by consult a doctor if someone in the family had a diarrhea. Disability limitation prevent the patient from developing dehydration, and rehabilitation, bed rest, and slowly doing activities.
Pathogenesis of diarrhea. The incubation period of diarrhea varies depending on the type of germ. For example, Vibrio cholera. Symptoms: watery diarrhea. Duration of illness: severe day with adequate hydration.
Dengue is mosquito-borne disease caused by any one of our dengue viruses, which is dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4. Infection with one serotype of dengue virus provides immunity to that serotype for life, but provides no long-term immunity to other serotypes. Thus, a person can be infected as many as 4 times, once with each serotype. Dengue viruses are transmitted from person to person by Aedes mosquito, most often by Aedes aegypti in the domestic environment. As the mosquito feeds on the human host, it injects the dengue virus into the bloodstream and surrounding epidermis and dermis. Infected local cells then migrate from site of infection to lymph nodes, where monocyte and macrophage are recruited, which become targets of infection. Consequently, infection is amplified and virus is disseminated through the lymphatic system. As a result of this primary viremia, several cells of the mononuclear lineage, including blood-derived monocytes. Bone marrow cells have also been shown to be susceptible to infection with the virus. In severe case, viral load is very high and many vital organs are affected. Virus-infected macrophage produce a number of signaling proteins such as interferons, cytokines, chemokines, TNF, other mediators which are responsible for many symptoms such as flu-like syndrome and pain. Fluid from blood vessels start to leak out so that the blood volume decreases, resulting in low blood pressure. Decrease in blood pressure causes insufficient supply of blood and oxygen to vital organs such as brain. Dengue also infects bone marrow so that bone marrow cannot produce sufficient platelet. Since platelets are needed for blood clotting, dengue infection causes blood clotting defect and increases the risk of bleeding. Demographic and social changes such as population growth, urbanization, and modern transportation contribute greatly to the increased incidence and geographic spread of dengue activity. As travelers move from endemic area, they tend to serve as vehicle for further spread. Today, dengue hemorrhagic fever is regarded internationally as the most significant mosquito-borne viral disease. It is endemic to more than 100 countries worldwide, especially tropical and subtropical regions. The incidence of dengue fever has been associated with the amount of vegetation, tree cover, housing quality, and surrounding land area. Indonesia, a transcontinental unitary surveillance state located in Southeast Asia, is a tropical country where both main mosquito vector species of den virus, Aedes aegypti and Aedes albopictus, are endemic almost in all regions. Along with man-made breeding grounds, climate has also been shown to influence dengue ecology by affecting factor dynamics, agen development, and mosquito or human interaction. Temperature influences factor development rates, mortality, behavior, and control viral replication within the vector. Warm climates allow for larva development and an increased speed of virus replication, whereas cold climates slow down viral development and decrease the mosquito survival time, thus decreasing the possibility of an infection vector and decreasing the transmission of dengue fever.
5 levels of prevention for dengue hemorrhagic fever. The health promotion by promoting of 3M around home, that is, draining, closing, and burying. And then specific protection by using insect repellent and using mosquito net while sleeping. By early diagnosis and prompt treatment, giving fluid and antibiotic therapy and observe vital signs. Disability limitation by prevent sepsis and disability. And the last one, rehabilitation, optimal bed rest until getting better condition.
Pre-pathogenesis of dengue hemorrhagic fever.
Transmission from human to mosquito can occur 2 days before someone shows symptoms of the disease. The intrinsic incubation 3 to 14 days before appearing clinical symptoms appear 2 days 4 to the 7 day. Meanwhile, extrinsic incubation lasts about 8 until 10 days.
Pest is a disease caused by Yersinia pesticea bacterial infection, best better known as Black Death. can cause loss of life if handled by medical experts immediately. Pest is an infection of the lymphatic system, usually resulting from the bite of an infected flea and enters human through injured human skin. Fleas are often found in rodents such as rats or squirrels. All gender and age have the same high risk and work that is vulnerable to bubonic plague such as scavenger, cleaning worker, or hunter. Pests usually infect areas that have a cool climate because fleas are more actively alive and moving in the cool regions. An environment that influences the increase in bubonic plague such as dirty environment, unclean sanitation, and many rodents in the environment.
5 levels of prevention for pests is health promotion by promoting of cleanliness of home environment of the virus carrying vector. Second one is specific protection by using traps for rats and using shoes to protect our feet. Early diagnosing and prompt treatment by having a family examined if being bitten by rodents. Disabilitation prevent death because this virus so deadly, and rehabilitation optimal bed rest until getting a better condition.
Pre-pathogenesis of pest disease or plague disease. There are 3 types.
First, pneumonic plague have an incubation period 1 to 4 days with a maximum of 6 days. Transmission of pneumonic plague, inhalation of contaminated aerosol, signs and symptoms, gastrointestinal symptoms, and tachypnea in children. Second, bubonic plague have an incubation 1 to 8 days. Transmission of bubonic plague, bite of infected rat flea. Symptoms of bubonic plague, gastrointestinal discomfort, skin lesion at the site of the flea bite. Third, septicemic plague have an incubation period 1 to 4 days. Transmission of septicemic plague, site of primary infection may be unknown. Symptoms of septicemic plague, acute fever, gastrointestinal symptoms.
Typhoid fever caused by Salmonella typhi.
Typhoid fever is a systemic infection with the bacterium Salmonella enterica serotype type. Salmonella enterica serotype type is a member of the family Enterobacteria, CI. The bacterium is serologically positive for lipopolysaccharide antigens O9 and O12, protein flagellar antigen HD, and polysaccharide capsular antigen V. Typhoid is usually contracted by ingestion of food or water contaminated by fecal or urinary caries, excreting by Salmonella typhi bacterium. The infection dose of Salmonella enterica serotype typhi or Salmonella typhi is volunteers varies between 1,000 and 1 million organisms. V-negative strains of Salmonella enterica serotype typhi are less infection and less virulent than V-positive strain. Salmonella enterica serotype type must survive the gastric acid barrier or reach the small intestine, and low gastric pH is an important defense mechanism. Salmonella organisms are able to survive and multiply within the mononuclear phagocytic cells of the lymphoid follicles, liver, and spleen. At the critical point that is probably determined by the number of the bacteria, their virulence, and the host response, bacteria are released from his sequestered intracellular habitat into the bloodstream. The incubation period is usually 7 to 14 days. In the bacterium phase, the organism with widely disseminated, the most common sites of secondary infection are the liver, spleen, bone marrow, gallbladder, and Peyer's patch of the terminal ileum. Typhoid fever was an important cause of illness and death in the overcrowded and unsanitary urban conditions of the United States and Europe in the 19th century. The onset of the bacterium is marked by fever and malaise. Patients typically present to the hospital toward the end of the first week after the onset of symptoms with fever, influenza-like symptoms with chills, a dull frontal headache, malaise, anorexia, nausea, poorly localized abdominal discomfort, a dry cough, and myalgia, but with a few physical signs.
5 levels of prevention for typhoid fever. Health promotion by promoting of typhoid and maintain our health. Specific protection by cooking food and using vaccine in early childhood. Early diagnosis and prompt treatment, going to hospital if someone had a fever. Disability limitation, prevent disease from complicating. And the last one, rehabilitation, optimal bed rest and eating good food.
Pre-pathogenesis of typhoid fever.
Typhoid fever typically has an incubation period 10 until 14 days and is usually associated with prolonged low-grade fever, frontal headache, malaise, myalgia, dry cough, anorexia, and nausea. The fever may progress in a stepwise manner to become persistent and high-grade by the end of
Leptospirosis is a global important genetic disease caused by spirochetes of the genus Leptospira. Usually occurs during the flu and is generally transmitted through red urine. According to the International Leptospirosis Society, Indonesia is a country with leptospirosis incidence ranked third below China and India. In some publications, the mortality rate is reported to between 3% to 54% depending on the system of the infected organs. Modes of transmission of leptospirosis. 1. Direct contact with urine or tissue of infected animal. Example, through skin abrasions, intake mucous membrane. 2. Indirect contact. Example, broken skin with infected soil, water or vegetation. 3. Droplet infection. Example, inhalation of droplets of infected urine. According to the Gracia and December 2010, host factor of leptospirosis consists with first, age, more in 20 to 30 years old. Second, sex. Males greater than females due to greater occupational exposure. Third, high-risk group, agricultural workers, fishermen, sewer workers, lorry drivers, and masons. 4. Environmental factors, rainfall, poor sanitation, presence of rodents, cattle, and stray dogs. Walking or working barefoot pose high risk. According to the World Health Organization, in developing countries, especially those with hot or tropical climates, the incidence of leptospirosis is more than 1,000 times compared with subtropics countries with a greater risk of illness.
5 levels of prevention for leptospirosis. Health promotion by promoting of leptospirosis and prevent on drinking uncooked water. Specific protection by using distilled water and cooking water before drinking. Early diagnosis and prompt treatment, having a family examine if someone got sick. disability limitation, prevent organ failure by optimal therapy, rehabilitation, optimal bed rest until getting better condition.
Prepathogenesis of leptospirosis.
Leptospirosis disease have an incubation 5 to 14 days, and symptoms of leptospirosis: diarrhea, vomiting, jaundice, rash in skin, and then duration about 5 to 7 days. Duration convalescence of leptospirosis 4 until 30 days.
This is a tutorial from us how to make trash can from used material.
Okay guys, thank you so much for watching. Don't forget to always throw garbage in its place.
Matur susumo lan pramasanti. Om Santi 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 Om.
Matur sekelangkong.
Matur tampiasi.
Suksema.
Matur sakalangkong.
Matur suksema.
Matur suwun sanget.
Matur suksuma.
Om Santi 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 Om.